If you or someone you know and love is battling substance abuse issues, it can be an overwhelming and very kind of isolating feeling, I think, sometimes. We're very happy this morning to have Chandler Keel on the show. He is with Bradford Health Systems, also Cornerstone of Recovery. Good to see you this morning.
It's a pleasure to be here.
So I think I had that right, Bradford Health Services. I made it systems because, as you and I were talking, the Bradford Health family really encompasses all different types of mental health and substance abuse concerns.
That's
right?
exactly right. Yeah, so Bradford Health Services has been in operation since 1977. We acquired Cornerstone of Recovery several years ago, but it's been in operation for just over 35 years. And we have a network of services expanding 11 locations.
So, you know, I think that this is accurate to say in the medical field in our country, one of the most underserved and underpopulated is the psychiatric world, the mental health world. So that if you find yourself in this walk and you need some, especially in-house, so to speak, help, if it wasn't for Bradford, you may have to go far away.
That's exactly right. Yeah, so the psychiatric services and the psychiatric issues that are facing our society at this point in time are compounded significantly. We've seen a real rise over recency that indicate that patients are struggling with mood disorders, you know, beyond what had been traditionally understood. So those individuals that we're becoming to learn a little bit more about and that are compounding into maladaptive coping mechanisms like alcohol use disorder and substance use disorder, oftentimes we find ourselves having conversations with patients of what came first, the chicken or the egg? Mm-hmm. Was it the mental health or was it the substance use?
Yeah.
And ideally, we're positioned in a way to where we don't have to define that. We have services that can accommodate patients at any point in their journey of understanding what they're predominantly pursuing care for.
We're seeing an increase too in our younger population. So at Cornerstone, what ages do you serve?
So at Cornerstone, we serve ages 18 and up.
Okay.
So it's an adult campus. But we do have an additional adolescent campus over in North Carolina where we're able to serve individuals of the male population ages 14 to 18.
Okay. Are you ever a resource, I mean, back to this umbrella network of Bradford, do people ever come to you and maybe they're not someone you can help? Maybe they have a daughter who's 14.
Absolutely.
But do you guide them?
Absolutely. So much of the way that we really navigate providing services and understanding where patients are best served is to really be the best resource to the community. There are oftentimes instances where we can't serve a patient, whether it be a psychiatric acuity, a mental health acuity, a medical acuity, a clinical acuity, or a financial inability to meet the expectations to admit to our programs. And so ideally, we are providing that patient that's pursuing care an appropriate resource should we be unable to serve them at that point in time.
I'm kind of looking over your shoulder,
Yeah.
and I'm sorry if I'm not making
No,
eye
you're
contact
fine.
with you, but this beautiful porch that is behind you, that's part of Cornerstone. So I'm guessing that some of what you do is to embrace the environment and the beauty.
Absolutely. So one of the key things that we look at in addiction treatment is this idea of experiential therapy. And what that allows us to do is it allows patients to get into their body and out of their head. And so much of that allows us to do intensive trauma-based work, which more often than not, when individuals are experiencing substance use disorder, there are compounded traumatic events that have led to their inability to cope with life on life's terms. And so making sure that we have an environment of care where patients can pursue and receive that service is of essential importance. Making sure that there are multiple pathways for patients to connect to a certain message that's provided within the clinical setting so that they can overcome those issues.
So, you know, I think if you're the one struggling with this concern, it's probably your whole world right now. And you want very much to hurry to get the solution that's going to work for you. Can anybody take advantage of the in-house? What's the right phrase for me, by the way?
Totally fine. So we pursue admission, and any patient can contact us for admission. You know, one of the things that we look to achieve is to make sure that patients have access to our admissions counselors, which perform an actual clinical pre-screen, ensuring that patients are the right fit. And we look to have that resolved within no more than 2 hours. So we intend to be extremely responsive to patients. We know that the willingness to pursue care and the opportunity for an individual to get into care is of utmost importance. And it's our job and our duty to the patients and to the community to be as responsive as we possibly can.
Can you overstate the power of sometimes removing yourself from your current environment and having this retreat almost that you find at Cornerstone?
Yeah, so I would say two things. I would say first and foremost, The way that Bradford has intended to develop their programs is positioned to be a community resource. We want to be able to serve the immediate communities that we're placed within. More often than not, patients need a reprieve from daily living to be able to step away from the stressors of family, children, work, their environment, old friends and old places, making sure that they have that safe, serene, and controlled environment to start their recovery journey.
How long are they typically there?
They're typically with us for 30 days.
Okay.
We operated off of a 30-day model.
Can they extend if
We
they wish?
can extend, that's exactly right.
Okay.
And we do prefer that there's the opportunity to extend. And what we're talking about most predominantly within that safe and serene environment is going to be our residential campus. But one of the things that Bradford Health Services does offer are 11 intensive outpatient programs across the states of Tennessee and Alabama. And so making sure that wherever that patient is positioned, there is a security blanket for that patient to return back to their home environment while continuing clinical programming.
There is no way we can have an adequate conversation in just 6 or 7 minutes. And if you're watching and you're walking this walk, I'm sure you're wishing you could have much more time hearing from Chandler and his team. But here's the number where at least you can go ahead and reach out. It's 888-SOBER-40. You can learn more at cornerstoneofrecovery.com. That's the website for the recovery center there near Knoxville, not far from here. But then they do have these off-site campuses in Chattanooga as well.
That's exactly right.
Good to see you.
Thank you so much.